Today I want to do something different and I'm very excited about this. Hello and welcome to another episode of Dr. Simone Says. My name is Simone Eastman Yuan. I am a medical doctor with sickle cell disorder, and I am also the best-selling author of the book A Doctor in a Patient's Body, Dreaming Big with Sickle Cell Disease and Chronic Pain. I'm retired from my medical practice, but these days I like to make sure that every sickle cell survivor becomes a sickle cell thriver because it matters that we live well. I got some feedback regarding how people are dealing with this information, how they're able to absorb this information, and because some people are chiming in from outside of the country, there could be problems with buffering and things that lead to a very choppy delivery of the information. And so someone had the great idea that maybe we should do it in such a way that it's a presentation, and so instead of seeing my face and having it be a conversational style, we could instead do it with the information, the content being seen on the computer, but you will also be hearing my voice and I will be explaining what's going on. And hopefully for people who might even have a language barrier, this might be a better way to deliver the information as well. So I decided to start with something that I already have. So back in May, I was asked to speak on a patient panel, and I had to give an early submission of what I was going to speak about. So I did a PowerPoint presentation to speak, and then we got there and everything was changed up. So I was asked instead to just kind of speak about myself in general, kind of give the audience a sense of who I am. I went there thinking I was going to present something on the topic of sickle cell disease and sickle cell disease management. So I did submit that presentation, but it was never shown. So I thought, if we're going to start today with working with a PowerPoint presentation, why not start with that? And I could show you and share my thoughts with you about what I think regarding this subject matter. Today, the subject matter is going to be about PTSD and sickle cell disease. Now, I submitted that topic back in May, and since then, I've actually heard a few discussions about PTSD and sickle cell disease. It's amazing how when it's time for something to kind of manifest, it comes in every direction. So my presentation was submitted in May, and since then I've heard some Facebook discussions about PTSD and sickle cell disease. So let me go ahead and turn the camera around and show you what I was thinking about and what I was concerned about and how I think we could address this problem. Now, keep in mind that when I was talking to a combination of patients with sickle cell disease and caregivers, but also to pharmaceutical companies and other organizations that had the potential to really step forward and help in this matter. So I didn't change anything about the presentation. I wanted it to be authentic. So when I start talking towards the end about what we can do to help, it is geared still to those corporations and those organizations and companies, and I am hoping that they are at some point able to even listen to this video and consider partnering with us to help us with our cause, as we often help with being part of clinical trials and things like that. I'm hoping we can work and have a mutual benefit to each other. So without further ado, here is my presentation. Okay, guys, this is Dr. Yuan here, Dr. Simone Yuan, and I am back, and this is my attempt at having you see what I'm seeing, which is my computer screen. I am without a doubt sure that there is a better way of doing this, probably where I could even share the screen and talk with you guys as we go through the slides. But I think for now, with what we have, we will make do. So this is the presentation that I was telling you about, and I want to talk to you guys. And this is what I intended to talk to the pharmaceutical industry and organizations for sickle cell disease and other companies. This is what I wanted to talk about. 911 emergency PTSD in sickle cell disease. The reason I picked this is because I know that some of you have read my book, and I will use every opportunity to talk about this book because I wrote it so that I could help. And the only way that it could be of help is if people get to read it. Initially, when I released the book, I released it as a digital copy, free of charge on the first day, because I wanted people, especially from other countries, to be able to log in and get a copy of it. Of course, I since then it's been on Amazon for sale, and I would love for you guys to pick up a copy, because part of what I am presenting today is what I talk about in this book, and that is the experience that we have as patients in the emergency room. Guys, if there is anything I could change before I leave this earth, it would be our experience with sickle cell disease in terms of obtaining health, in terms of navigating the healthcare system and making it friendly, so that when we are triggered, when we have to present to the emergency room, it is not an anxiety provoking event. It should never be an anxiety provoking event to seek care. But right now, that is the state of affairs for sickle cell disease. And so this is what PTSD is. Now, according to the NIH, Institute of Mental Health, so National Institute of Health, Department of Institute of Mental Health, they say post-traumatic stress disorder is a disorder that develops in some people who have experienced a shocking, scary, or dangerous event. I think that you can clearly see that people with sickle cell disease have experienced, with their sickle cell disease and navigating through the emergency room, a shocking, scary, or dangerous event. Many times we present, people don't even know our disease, and so we're having to educate them about the disease at the time that we are crashing. If that's not dangerous, I don't know what is. Mayo Clinic says PTSD is a mental health condition that is triggered by a terrifying event, either experiencing it or witnessing it. That now ties in our caregivers, because oftentimes our caregivers, in the form of our partners, in the form of our parents, in the form of friends, they are witnessing these things as we go through them. I know that I had a friend who would always come with me to the emergency room, and on one occasion they were trying to access a vein, and I was stuck 13 times before ultimately having an intrajugular central line placed. And by the time she was seeing the 13th stick, she just broke down, started crying, and said, "This is horrible. I can't believe this is what you go through." And that was a good day for me. I mean, I was apologizing to the nurses that, I was, such a hard stick because I've had sickle cell and I've had transfusions and hydrations. And so my veins are difficult. But this woman was clearly traumatized by the just that experience. And so I think to myself, if she's traumatized, imagine what we are when we have to present over and over, and that's actually considered a good day. So, based on the definitions that we just read, we are now looking at PTSD in sickle cell disease. So, a sickle cell disease crisis can be a shocking, scary, or dangerous event. Sickle cell disease itself is experienced as a recurring, terrifying event often. It's not every time experienced like that, but it is often experienced like that, especially when we have to present for care. Patients experience a high incidence of anxiety or depression from the impact of their illness. So we have that to contend with as well. So, how does it happen in sickle cell disease? Well, we experience a physical trauma called sickle cell crisis, and then we report that trauma to what we consider a safe authority figure, usually an emergency room doctor or nurse, but it could also be our primary care physician because our first port of call oftentimes is primary care. So we may see our primary care physician. They have now become the authority figure that we present to for care. But more times than not, especially for the seasoned patient, we will present to the emergency room doctor or nurse. And the first response we might get, so usually it's one of two responses. So the first response is, "You have no trauma, your labs look normal." How many times have we presented to the emergency room where our labs are normal and defying everything that we are going through in our bodies? I mean, our bodies could be raging with pain and the lab results are normal. Now we know from the 2015 expert panel that the sequelae, so the onset of a sickle cell crisis will present with normal labs, and oftentimes the abnormality isn't reflected for a week or two behind the initial presentation. By then they have sent you home. By then they have sworn off in their heads, many of them, not all of them, many of them, that you had no problem. Meanwhile, your systems were crashing. So when you present like that with the labs normal, your motives get questioned, right? Your motives are questioned because they're not seeing anything and they are treating now the labs and not the patient. And so no significant treatment is usually given. In fact, people are not admitted when they're crashing. They get discharged from the emergency room in 10 out of 10 pain, and they go home and curl up and sometimes could turn to other sources of treatment because they didn't get it from the right place, which is really unfortunate because then you're having to put your health in jeopardy to find other sources of help that might not be but that might not be good for your health, that might not be safe for your health. The second response we usually encounter is, "Well, you do have trauma, your labs look abnormal." And to that we say amen and hallelujah, because we finally feel like we've been vindicated, that our labs reflect what's going on inside. But then we get admitted and we're put on a routine that, honestly, when you calculate the 24-hour administration of medication sometimes, and you compare them to what you take at home, it could be equal to what you take at home or even less than what you take at home. And so they're giving you what they have as a general pain management, not realizing that your body's already accustomed to that level of medication because you have had to use that at home, sometimes on a chronic basis, for pain management. And so when you present, you've already passed the point of their normal pain management protocol that they have in the emergency room. You have now graduated onto something that requires probably 3 or 4 times what they are presenting to you. And there is a protocol that talks about how you can convert what you're taking at home to what you should be getting in the emergency room when you present. And that's on my video that talks about presenting to the ER for management in sickle cell disease. But your motives are questioned. Your need for the amount of medication is questioned. Your need for the frequency of medication is questioned. And often your pain gets undertreated because you are having to wait and wait and wait for a small amount of medication that barely takes the edge off. And then you have to, so you get relief for maybe an hour, and then you're back to groveling, you're back to begging, you're back to trying to convince them that you are a legitimate person, a contributing member of society that happens to be presenting in pain because of your sickle cell disease, that you are not a drug seeker, and that you just need a lot of pain medication because your body is already accustomed to being treated with pain medication. But ultimately, many people, and this is what really breaks my heart, many people feel pushed out of the hospital before you're stabilized. And I want to say something about this because I as a physician, I can see both sides of this issue. And I do believe that part of it is fear. Part of it is not knowing how to treat someone with high doses of pain medication on a continual basis. Most people haven't treated sickle cell at length when you present to the emergency room or you present to that hospitalist once you're admitted. And so they're very uncomfortable with the amounts of medication it's taking to stabilize your pain. You have nothing to do with that. Your systems are crashing, and you're basically reporting your pain scale on a scale of 1 to 10, and then they're not comfortable with that pain scale that they created when you then tell them, yes, after you've treated me with what you think is a maximum dose, my pain is still an 8 out of 10. And so now, because they are uncomfortable, they don't know how to handle it, they haven't been taught well how to do the equianalgesic dosage, meaning what is the equivalent of what you take at home, and then where to start from that, and how to pace it with at what interval. They are not taught that very well, and so they are uncomfortable and feeling a little bit out of control. And because they feel out of control, they then want to get rid of the problem. And the easiest way to do that is to discharge you, unfortunately, when you are not yet stabilized. So people feel rushed out of the hospital. I have heard people have taken to social media to videotape what's going on, and it has been horrendous to hear. I don't think the medical institution has caught up with the fact that there are other ways to expose what is going on. But I have seen a lot of things on social media that basically reflect and vindicate patients when they talk about hospitals sending them home in 8 out of 10 pain before they're stabilized, simply because they are uncomfortable with the level of medication, the amount of medication they are having to use to control their pain. So you are basically left undertreated and still sent home, which then again puts you at risk because you can then use things that are not safe for you to control your pain. So you are sent home untreated or undertreated. You feel, I feel when this happens to me, I feel disrespected, distrusted, demeaned while I'm down. So you're kicked while you're down, essentially, is the feeling that you will get. And you, from that, I I then think that doctors and maybe all providers, maybe even people in the research community, maybe people in the pharmaceutical industry, I don't know how far this reaches. And this is especially true for someone who is not in the science community, who is not in medicine. You know, we don't know where one uh, specialty ends and another begins, or where one field of medicine ends and another begins. So for that person, they will look at the entire medical health community and think these providers, whether they are researchers, whether they are doctors working on medications, that somehow they can't be trusted, because if they are sending me home like this, and they must not care whether I lived or died, and so then I can't trust them. And so then they go home, you go home and you have thoughts of, um, you know, I don't ever want to return to the emergency room. And if you ever get pain that you think would head in the direction of going to the emergency room, it produces extreme anxiety. And then that, of course, causes you to have more pain. So ultimately, we don't want to go to the ER or present to the ER for any pain management. And we feel like we left with a bigger wound than the one we came to treat. The average patient feels like that has gone through the system and that has been mismanaged by the system comes out feeling like they may have been treated physically, but the wound that was created emotionally and on their self esteem is creating a bigger problem than even the physical ailment that they came in with, the pain crisis that they came in with, and almost wishing that they didn't present to the emergency room. Now that is PTSD. When you have thoughts of anxiety just at the thought of having to go back the next time, when you are stuck emotionally on the experience of being mistreated, when you pull away and you only can talk about these things in a group, in a support group setting, because you feel unsafe, because you feel like nobody cares, because you feel like the only person that could understand is another sickle cell thriver, that becomes PTSD. That's when you're looking at a post traumatic stress from an event that was significant enough that it made you decide that you did not like going to the emergency room and that you would rather stay home and suffer. Why should it matter? It matters because of many reasons. For us, it matters because it creates distrust with between us and our providers, and oftentimes the next provider that comes down the line gets gets it's unfortunate, but they get the result of what happened to us previously. So instead of being able to start from scratch, we are now with our guards up. And so we see another provider, and that provider might be well intentioned, wanting to help, and all the emotional baggage that we are now carrying gets dumped onto that provider, who then decides that, well, maybe, this is the way things are with sickle cell patients. Maybe they all act like this, and so it perpetuates, unfortunately, that stereotype, because we have been traumatized and we haven't gotten help for that trauma, and we're walking around with that emotional baggage. Um, we also believe that all the healthcare providers uh, don't care, and that we usually include the science community, and that's the part that is a little scary, because when it comes to research and it comes to clinical trials, we 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 in, we in, we put them in the same category as our providers, as our other healthcare providers. And so we don't see them as any different. And so when they're coming and asking us to participate in the clinical trials, the participation rate is low because our trauma is high, our distrust is high, and we can't see past that, because traumatized people have a hard time telling whether that person is a friend or a foe. And that person ends up getting faux treatment, so to speak, even when they could be a friend. The same is true in nursing. That new nurse might come and end up getting the baggage that you have left from your previous relationship or your previous encounter with the healthcare system. What does it mean for providers? It means that they are at risk for not connecting with patients. It means that they are at risk for not enrolling patients for those who are in the science and research community. It means that they need to know, that we need to know that they are a friend, because friends help in a crisis. And so if they are not present in our communities when we are needing help, if they are not present in our communities to talk about the challenges in our communities, it becomes difficult to identify them as a friend, and it becomes difficult to allow them in simply when they have a new drug that they need to share with our community. Now, I am all for clinical trials. I I certainly am cautious about which clinical trial I participate in. I would like help in better management of my sickle cell disease, but ultimately, I would love help for something that significantly changes things and not just manage a symptom. So, but it's very difficult. It's very difficult because there's so much distrust there. And so the pharmaceutical industry, the organizations that support sickle cell disease, the other companies that are involved with producing all things sickle cell, they really need to come closer. They really need to have dialogue with us and help us to see that they are a friend and not a foe. And like I said, a friend is there in a crisis. So when we are having this dialogue, we need to be able to speak about the things that hurt in the community in terms of our health management, and have them listen with the intention of finding a solution for these things. For example, I believe that videos, teaching videos and things can be made for for the healthcare industry, for our healthcare providers to learn. They can watch them and learn as a part of their continuing medical education. They're always having to go to conferences and do things that would give them continuing medical education credits. Why not have one of those or many of those be regarding sickle cell management and sensitization of just cultural sensitivity, so that they are aware of what's coming down the pipeline, they're not reactionary, and that they are on top of management so that we gain trust as we see them managing us better. So, what we both need is that we need, as I mentioned, to help provide sickle cell training for emergency room staff, but honestly, it's primary care. So it's and specialty care, because there are hematologists that don't know how to manage sickle cell disease, and that's really unfortunate. I have had to teach my hematologists about sickle cell disease, and when they come back all excited and tell me, oh, you have SC, so it's not going to be so bad, while I've had a hip replacement, back surgeries, 5 hip surgeries, that doesn't help me, because then I realize they're following the textbook, that they haven't caught up with the information, and they have and so they're spouting out information instead of getting to know patients with sickle cell disease and how their presentations vary, and how what the book says versus their reality is often very, very different. So if we could have all those organizations contribute to providing for training for the science and medical community, and providing sensitivity training as well, if we see them doing that, we will be more inclined to work with them, because we will identify them as a friend and not a foe. And we will get the better treatment, the better management of our sickle cell disease. But until then, we are still having to manage with the PTSD, and I think that going forward, there are probably many people that will have to acknowledge that they have PTSD, and that they need to have that treated, so that when they present to the emergency room, it's not such a traumatizing experience. Until next time, this is Dr. Simone Says, and remember, you are a sickle cell thriver, not just a survivor. If you benefited from this video any at all, please like on the video, comment, subscribe to the channel, and share the link with one other person as your contribution towards the sickle cell cause. Have a great day.